So it's good that we are having a health informatics conference being conducted by Apollo Hospital, and this is a field which is probably one of the last frontiers of medicine, because this is an area where a lot of people are, a lot of institutions are trying to go ahead, but there's a lot of resistance for various reasons. Most definitely it is something that is very helpful. In fact, you can call health IT as a force multiplier, because it allows you to do much more with the same resources, with the same clinical medical resources than you could do without computerization. So the analogy, if you look at it, is the banks and the aviation industry being computerized. They are able to, all the people who use it are able to use it remotely, and we are actually getting more throughput than was possible a few years back or a few decades back. Of course, with health IT, it's not a question of more throughput, it's a question of better clinical care, more safety, and allowing any doctor, whatever his level of expertise, to come at least up to a certain level of expertise. So it maintains a uniform quality control by decision support, so that the doctor is aware of what is happening to the patient, what he needs to do next. These things are not possible clinically without health IT. Yes, you will find that there are very good doctors in the field who have been managing for hundreds of years without any health IT and are getting very good results. But the problem is that these doctors are few at the top. There are doctors who are mediocre, there are doctors who are bad. With health IT, our aim is to improve the quality that the mediocre and the bad doctors give by ensuring that all the information to the patient, of the patient, is given to the doctor in one go, and he can make informed decisions. It is possible for a health organization to computerize simply for computerization's sake. I've seen a lot of hospitals have electronic medical records which actually don't add any value to it. For instance, they have everything stored in free text. So the doctors come and type, they're very happy because they like typing rather than clicking a dozen fields and entering data. But that's not really the right way to go ahead, because the data that is stored is really of no value, cannot be analyzed, and if it cannot be analyzed, the doctors cannot act on it. The system cannot act on it by providing you decision support. So designing a good electronic medical record actually starts right at the drawing board when the blueprint is made, to ensure that at the end it does produce some sort of benefit. A lot of hospitals are computerized when they say their medical data is computerized, but if you look at it, it's basically admission, discharge, transfers, and a little bit of diagnosis for using ICD-10 or some other coding system, but they're not capturing the rest of the clinical data granular. Rest of it is in free text. It is possible for the medical records department to go through all of these and then categorize the free text, but practically it's not feasible simply because they don't have that level of expertise. Now that SNOMED CT has come in, it is possible for systems to be built that will do coding on the fly. And actually, SNOMED CT is the biggest tool that is available to medical IT personnel to get all entered clinical data in a very granular fashion, in an analyzable fashion that will actually benefit the organization.